Hello, welcome to the For the Love of Learning, and I'm your host, Dr. Carl S. Moore, Vice President for Teaching and Learning at Howard Community College. And I'm super excited because I am delighted to be joined by a colleague here, Tim. Tim, I always say your last name wrong. I'll say Jenkins. You know what? Jennings, right? Tim Jennings. So if you can just introduce yourself and your program, and then we'll get started.
My name is Tim Jennings. I'm the faculty coordinator for the EMS program, where we handle EMTs, paramedics, and EMT and paramedic transitions to alternative allied health areas.
Wonderful. And then I must ask you, because of acronyms, everyone thinks they know what EMS stands for, but I'm not going to assume that I know. So what does EMS stand for?
EMS stands for Emergency Medical Services. On our campus, if you look through our literature, it's put in as EMSP.
Okay.
EMS program. So
EMS program, great. And as I mentioned to you before, and I neglected to let the viewers know a moment ago, this show is to really highlight faculty members like yourself and the programs they teach in, because we want the community to learn a little bit more about what's happening, like in the classroom on campus, in a way that is just better than just reading about it. So tell us a little bit about some details of your program, some of the classes that you teach, and then we'll get into some of like your loves for learning and what the learners might love about your courses.
So the biggest thing about our program is that we prepare young men and women to enter the world of EMS. So there are two avenues you can take. You can take becoming an EMT and then going into a fire department, or going to a commercial service, or you can get your paramedic, again, join the fire department. You're able to then join a flight service, or you can become a police aviator. We have a lot of people who want to be police snipers, so some of the training that we do allows for them to be ahead of the class because they get that sort of training.
Oh, wow. Okay.
And we've been around 18 years this year, and we have one of the highest success rates in the state.
Oh, wonderful. And when you say success rates, is that like job placement? What defines success for y'all?
So job placement, we're at about 90%, only because there's some students who do paramedic and they want to move forward into another area, so they don't move forward with their paramedic career.
But 90%, that's high.
Right.
You know, especially compared to some folks that come
So
out.
we keep a really good relationship with all of our partners, and we work really well with them so that we can try to get the EMTs. We even have a program where we're trying to get our EMT students who aren't certified yet what they call a PSC license, which would allow them to actually drive the ambulance before they get their cert. They can't do patient care, but it puts them in that environment, and they're getting paid.
Wow. So the other acronyms, I'm going to play. Some of them I know, but I'm going to pretend as if I don't know for the viewers. The EMT, what is that? Emergency Medical Technician?
On a broad scope, emergency medical technician is a broad scope with just a kind of a generic name.
Okay.
And then what happens is you have levels under that. You have your EMTB, your EMT advanced, you have your EMT intermediate, which means they're in between the EMT and the paramedic.
Okay.
You have your paramedic, then you have your paramedic advanced, and
Oh,
you
wow.
have your paramedic flight. And
So walk me through each of those, what they would do. So if I'm an EMT and I'm an EMTB,
So a EMTB has basic first aid skill, basic first aid knowledge, and they're able to give basic equipment and deal with broken bones, stop bleeding, give oxygen.
Okay.
If it gets to something that is more chronic or long term, then that's when you would call the intermediate, the EMTI, or the paramedic.
Oh, the EMTI is EMT intermediate. Gotcha.
Yeah, so in EMTP or EMT paramedic, they have a different scope of practice. Here in Maryland, we have about a 560-page protocol that we utilize to be able to treat certain circumstances. Abroad, Virginia, Delaware, Pennsylvania, they have a different system where your medical director, along with some state regulation, determine what you can do.
Wonderful. So in your program, you have it's EMS, Emergency Medical Services,
Right.
which they can obtain a certification in EMT to one of those levels, or they're
Right,
certified
so-
to actually go serve in one of those levels.
Right. So they have to get their EMT, and then that allows them to be able to move forward into our program or any other program. What we strive for, if the EMTs are transitioning forward, we really try to convey to them that we want them to get the degree, so that as they move forward, not only can they become a paramedic or a critical care paramedic, but then they can move forward to a four-year institution with an associate's degree.
Wonderful. So at least they have that. But without the degree, there certifications along the way where they could actually start working after a certain number of credits, or
So as at the EMT level, yes, at the EMT level, you can work. They recently made a change where, in order to graduate paramedic school, so to speak, you have to be at a four-year institution.
okay. But
at a two-year
institution
minimum.
institution.
So
Okay.
now you can, right now, until that goes in effect, a paramedic student could opt out of the associate's degree, and then they could seek their licensure.
So the licensure is the element for them to actually. So they're kind of training. The class serves as their training, that to prepare them for the licensure.
Right. So
Okay.
the class. So our paramedics do 260 hours of service. As a matter of fact, before I came, I was just getting a schedule for MedStar.
Okay.
So our paramedics do rounds in first the cadaver lab. They go to hospital systems, they go to fire departments, and then they go to commercial services, so they can get the full aspect of what is capable. Our EMTs go on ride-alongs, but they're not allowed in the hospital system because their scope of practice is below any that they would have in the hospital. So they are allowed to go into the ambulances and, again, in certain circumstances, learn to drive, but learn how to function as what we call BLS crew, or basic life support system.
Basic life support system.
Right.
And you just mentioned a cadaver lab, and that's one word I do know from just TV in terms of cadaver.
Right.
So if a student is in the cadaver lab, right? If we can just zoom in on this one part. What are they learning in the cadaver lab? What's the approach to teaching them about how to,
So we were now when we get technical.
Yeah, please do. We have no idea what happens.
So we use a direct teaching style, and we use more demonstration. So what happens is I give a lecture. I was able to write a curriculum, so the state gives our EMT students and paramedic students Con Ed credit for that program.
Mm-hmm.
The EMT learns the inners of how it works. It's difficult to understand how to treat the body if you do not understand physiology.
You're not dealing with
So we teach our students our EMT students more at an advanced level, only because every time, I think what people forget is when stuff hits the fan, when you make call 911, you're going to get an EMT or a paramedic. And hopefully you get one that's been trained at a proper institution, so you would have the ability. But in the cadaver lab, we show them the physiology of the body. So, for example, we crack the chest so they can feel the inside, they can see. So we'll talk about then what they would normally see, blunt trauma, penetrating trauma, and give them an idea of why. If you see a person and they've been shot one time, it's not the external stuff we're worried about, it's the internal, because it creates that temporary cavity and expands those organs, and it's a lot of inner bleeding that happens. And so we try to over-educate.
I appreciate that. And what you mentioned earlier, just a moment ago, you said that you said direct demonstration. You like to have a direct approach. Right. What was the word that you used? Was it direct approach?
Direct.
Yeah, I really like that, because it's you learn. It's not there's no theory. There's just straight practice, right? They're learning by doing.
Yeah. Well, we do have theory, because we do have the didactic portion of it, but I think it's, as you just said, there's no replacing actually seeing a heart, or seeing a heart that has been damaged, or even seeing somebody who had COPD lungs, who was a 30-year smoker.
Oh, wow.
And so you get to understand and visualize what happens to their body in decay.
Wow.
So it's something that we've been doing for the inception of the program, but I was able to we were able to find it, so we were able to create a circumstance that the EMTs and the paramedics will both go.
Wonderful. So from my understanding, and for the viewers as well, or the folks who are listening in, so I am EMS is you're a faculty in that program and a coordinator for EMS.
Yes.
But then I can get an associate's degree so that I can EMS
your associates will be in emergency
medical services.
Right.
And I get certification in EMT, some variation or version of it depending.
So in your EMT you'll get two. You'll get the national accreditation. And then you'll get the local accreditation, which is DC. But our students, we take them to get DC and Virginia certified, because most of our partners, they don't just work in Maryland, they function in DC and Virginia. So once they pass the National Registry, we make sure that they've signed up so that they can then get the other state licensures.
Okay.
And that is a benefit, because the more certifications an EMT has, the more he or she can make. Yes. Coming out of the door.
And you had mentioned earlier about encouraging them to go on for their bachelor's degree,
yes.
Or to definitely complete their associate's degree, right? So then, if an EMS student, if one of those students goes on to pursue their bachelor's degree, where could their career be with I think we know in terms of what you said about licensure right now. Due to licensure, you don't need an associate. Then we know. I would like to know, with an associate's, but then even with the bachelor's, what are the levels of progression in any area of the field that they what doors do they open for themselves with that?
So we have an aggregate program with GW.
With
George Washington University and with UMBC. And when students leave here and go to one of those programs have two tracks, a paramedic management track, and then they have an emergency medical services management track. The management track first allows you to seek jobs in management or jobs that deal with large crowds, because that's what they focus on. So large crowds, and the infrastructure it would take to make sure that you had enough AEDs, enough medics, enough police. Paramedic side of it prepares you for, if you go into a fire department, fire departments are requiring now that they're starting level, their EMS and their fire lieutenants have a minimum of an associate's degree. So as you move up to your bachelor's degree, that allows you to be able to teach, and then you are able to teach in very specific contents. So a regular paramedic who doesn't have the experience and doesn't have the degree wouldn't be able to teach pediatric studies or neonate studies. So you would have to be a paramedic that specializes in those areas. But it opens the door for you to be able to there's special licenses and certifications for those. And then when you get up to your master's, really that goes into teaching. You can do some stuff on the state level.
Oh, wonderful.
Yeah.
I think this is really great for folks to know about the progressions, because some people may be more so, hey, let me get my licensure so I can get a job.
Right.
But even after working, it appears that there's this whole career progression.
Right.
And it's great. And a job is different than a career, as you know, right?
Yes,
so
sir.
There's like a whole entire career piece here, which is exciting. So for you, did you start off with licensure or with one of those areas?
I was I actually got my paramedic in the military.
In the military,
and so
okay.
I was never an EMT, so I was never a basic level. I never did BLS. I was able to get my paramedic, and then when I moved this way, I was able to immediately utilize it on the street.
Oh, wonderful.
And so the difference in the military program is the military makes sure that you have all of the credentials before you leave, because when you're ETSing out, they want to make sure that
that's great.
And they just start doing that better. So, and you're absolutely correct. The biggest misnomer about EMS is that people don't understand that emergency medical services and firefighting are two different services.
Oh, okay.
And so here in Maryland has a large volunteer firefighter community. And so, unfortunately, EMTs and paramedics often get branched under that umbrella.
I see. Yeah.
But
yeah.
and then it's not what it is. They're actually two different fields of study. We tell our EMT, our paramedic students that they are, you're scientists, and the fact that as we move forward into EMS, what happens is people really forget that there's a level of physiology, there's a level of chemistry that you have to know. So, for example, if you had a person who was having a significant cardiac issue and you had to make a drip on site, you would have to do that. You can't call, can't
you can't. Yeah,
come,
no, yeah.
The supervisor's not going to come. So, and we have drugs like dopamine, epinephrine, that we can use to create a drip so that we can, on the spot, give the patient that medication that would help them in whatever the circumstances.
This is really fascinating to hear about, because I know that there are a number of students sometimes that take their AP course, their anatomy physiology course, and some of those courses serve as like barriers to students. But I do also know that with this program, because of applied nature, it can kind of end up being more, like you said, direct and practical. Can you talk to me a little bit about that? Does it attract certain students that may, or do students not know? Do people not know that they can kind of fulfill that like passion or their natural desire to like work on the body or with people or in this kind of way?
I'm going to say it's about 33.
Okay.
We get a third of the students who have had some influence, whether they had family or friends in the fire department, or family and friends who volunteered on the ambulance. And then those people come here, they know they want to be a paramedic, they know they do. Sometimes we get students who were not successful somewhere else. So maybe they tried nursing and they weren't successful and they stepped into EMS. The processes, the mental processes are very much the same. And then we get the other third who have absolutely no idea what they want to do. They have absolutely no idea.
And they're just trying it out?
Right.
Okay.
We've had students do that. It was like, I just didn't know what to do. And so what we try to make sure that they have is a complete understanding of what we do. Our field is the only field that the day you get your license or your card, you're expected to do your job.
Wow.
So if you're a nurse, a respiratory therapist, if you're anything else, you generally get a preceptor for a couple of months. Paramedics generally don't, because there's a workforce shortage, as I'm sure you've probably heard. But two, turnaround in this field can be really, really heavy because of that fact. It's a ongoing. People get sick, people get hurt, people die, and so if you aren't ready and prepared for that, that becomes an issue for some students. But then on the other side, we get students who they take away from that experience, and then they go back to a nursing, or they go back to cardiac vascular tech, and then they're stronger, and then they succeed.
So it could be a feeder back and even into like nursing or some of those other areas.
We actually have a program that if our students pass their national paramedic exam, they are eligible to go right into the nursing transition program. And it took about 2 years to get that program, and that was our chairperson, Ms. Berber, and the chairperson nursing, Ms. Archie Beaver, and there were three of us setting it up, because what we had was people coming from the military who couldn't find a path. And then people who wanted to be nurses, but they might have been put on the wait list. And the majority of the time, the wait lists are long.
Yeah, and what are you going to do in the meantime?
Right.
And
So that's what we tell them. Keep going to school, keep your head going. We're going to teach you physiology. We're going to teach you the meds. We're going to teach you cardiology. We're going to teach you pediatric advanced life support. We're going to teach you all these skills, so that once you get up back into the nursing track, it won't be as hard. And so our school, our standard is a little bit higher because of the physiology factor.
Wonderful. And the physiology, is that a course that is
They do A&P, but to be honest, Dr. Moore, you know how it is. Most students do what they have to do to pass, and then they leave it there. So
yes, I've seen that.
we try to train the paramedics the students in general, that it's a stacked learning process. So when I demonstrate with the students, I use a deck of cards, and I'm like, I can't if I'll put 5 cards out, and so these are 5 different areas of study. So with EMS, you have to bring the whole deck. You can't just, you got to stack them. Everything you learned yesterday, you bring to today. And the example is, I do not remember what my world lit class was when I was in undergrad. I do not. But I can tell you what the pancreas is, and I can, and that's the thing. There's some things long term in your world you use, but when you're talking about medicine and treating the body in the depth that we do, you have to have an idea of what's going on. If you don't, you're not going to be a positive influence on that patient, whether it's physical or mental.
Yeah, so if I'm a learner, and because of the applied nature, you think this field could actually help if I wanted to if I want to do nursing later or some of the other piece, because maybe as you get the confidence and you actually know and you see it real, and then you can leverage that, right? Is that kind of some of what happens with
okay. So we do a lot of clinicals, and we do that because we want our patients, we want our students to get to view all of the different things that we can see. And it's not, I can't with one cohort, I wish I could pull out every single thing, but there's so many different things. So we try to give them the main things, make sure cardiac, they can deal with trauma, they can deal with mental health, they can deal with children. So we put that out there. And for the students, who may be reluctant, we personally believe that we can help. If you want to be a paramedic, we'll
get you there.
We will help you. You just have to be motivated.
Okay.
The biggest problem we have most of the times is students just don't hit the deadlines.
Okay, deadlines.
Yeah.
So the deadline is more of the what might be in the way, or the next step, and not their ability to learn it. So what you're saying is you can teach them. You've seen it. They're students, but they have to be willing to put the accountability in terms of meeting the
So when you come into a medical field, it's difficult to work full time, because if you have classes,
so the investment as well.
So
okay.
If you have classes twice a week or clinical once a week, or any variation 3 times a week, and then when it's time to do clinical, you have to do clinicals. So our clinicals happen to be 12 hours. And some students, it becomes difficult because they don't want to set anything down. They want to try to juggle it. And so, just like the school's mission, what we try to do is we set them down, we do a timetable exercise, and then we don't tell them that they have to, put stuff down. But we're going to put down on this chart everything that you're doing. And you have to decide how you're going to move these pieces so you can get the desired education you need. We're going to provide you, even to an extent, if we have to give extra credit, we'll do that. But the major exams and the national exam, we don't give any leeway with those. But as far as the schedule, we try to be fair, because we understand people have lives, they have children, babies, they even have maybe taking care of an elderly, or they could be the only breadwinner in the house. And we've had that circumstance.
Okay.
So we are fair in making sure that students get the help that they need. I had one situation where I had to get the student activities involved, because we found out that a young lady was sleeping in her car with, and she had a small child.
Wow.
So it was, she didn't, at the point in which I found out, I let the student know, and the student was so embarrassed, and I was like, no, look, we're going to get you whatever help we can. We reach out to social services, and again, all of the departments in the school helped, and then helped her. So subsequently, she passed her paramedic on the first try, and she got licensed. She's now licensed in Pennsylvania.
Oh, wonderful.
DC.
Wonderful.
Yeah.
So she's gainfully employed, not working, doing it. That's wonderful. So, that's one of the things that I love about education in general. And, the name of the show is For the Love of Learning. What what are like a class or two that you teach? If you can kind of speak to that, and then what you love. What do you think students love learning about in that class, or what do you love about teaching those specific?
So more generally, I specialize in our pediatric program. So pediatric intensive care and NICU, neonatal intensive care,
right.
because those are my current areas, and I think the students enjoy me as an instructor is because I'm not afraid to bring it down. I'm not afraid to take the complicated topic and break it up so that they can understand it. Whereas this student might be the best reader, this student might not be the best at taking notes, and then this student is better with hands-on. So I do all three. I break it down so I can be the demonstrator, the facilitator, through them all. And that's the one thing. One thing they don't like about me is I'm stern on when they have
the
work
deadlines. Yeah.
And only because transitioning from us, whether it's a job or college, you need to understand that deadlines are part of it. So, we treat our students as like their employees. This is a job, and if you do it in practice, you'll do it when you play.
Yeah.
And so that's one of the things that they don't like. Other than that, if they don't get something, they can come to me and I can break it down so that it's easier for them to digest.
It's interesting. I'm big on assessment, right? And for how we're teaching and what we're teaching being like relatable to the actual job. And as we know in your field, time is important, right? So that probably has seasoned you even more so to be more. And it's like one of those things, like some classes, we are time bound, you have to turn it in. But in real life, doing that job, you could probably have like a month. But you have seconds for someone's life, you have. Yeah. So the time becomes, so it's probably a good thing, to have that time element, the accountability. Right. Now, as far as those classes, what do you think they like learning? What elements? Because I know what they like about your particular approach.
Yeah, I think that as we go through, of course, just to be weird, everybody likes seeing a weird car crash for some reason. I don't know if it's human nature. People just like
they like seeing they gore. Loved about the danger and the gore.
The gore, right?
Wow,
so us, when you see, I think for the kids and the infants and babies, they feel that connection because that is a child or an infant, and they're unable to. Yeah. So they love learning that because then they can then take that into their lives. So they take the adult stuff with them too, but it seems like when we're doing our pediatric stuff and our neonate stuff, they are more attentive. They are more attentive because they realize that with them I can't make the same mistake that I could make with an adult. We don't have that leeway or that time.
Yeah.
And our state mandates that your patient care report has to be done within 24 hours of patient encounter. So that's another reason why we hold them to that, because whether it's the fire department or commercial services, the state requires you to have that patient contact, that form in within 24 hours.
Oh, wow. So that's a time-bound thing.
Yeah. We don't wait a week before, because a week later, something critical you would have forgotten. And then if you get sued, which happens nowadays even more. If you get a good lawyer, of course they're going to ask you about something, and if you didn't write it down or you don't remember, then unfortunately that puts you in a predicament.
Well, I'm excited about, especially even that nuance, because I think the more upfront we are and transparent, and I imagine you do this, but even for a number of other subjects that we say, this is why, because it's one thing to say, hey, turn this in on time. Right. It's another thing to equate it to how this will really help you in your actual job. And there's a lot of direct connection to what you do in terms of it being time bound and really like what you just mentioned. So this is really great. So as we kind of close out here, is there anything about your program, EMS, or even some of the other sub-layers like EMT or any course that you teach, or even the field that you want to cover or share that you don't think you touched on before already during the show?
Well, any student who is registered at Howard and they have interest, there is no waiting list to be an EMT. You can come right into the program. There are a couple of classes for paramedicine. However, that's the same that's required for any allied help.
Okay.
So
Okay.
the math and then your A&Ps. So other than that, you can then become a paramedic or join our paramedic program. Anything that I forgot?
And there was the internal. You have internal. You mentioned nursing, and then you have external kind of partnerships. And you said the employment rate is like 90% usually,
Oh, right.
depending.
Right.
Are there any other elements of the internal other programs that can feed into or externally in terms of where that you didn't mention? You did mention some, but I'm not sure.
So our biggest internal program is with our nursing, and in the last 2 years, we've had 13 students finished and graduate. They became paramedics. They went to nursing school, and they graduated nursing school, and then are working as nurse paramedics.
Wow.
So it's right. So that program is good, and then we feed into almost all the programs except dentistry. Dentistry generally has a very specific group of people who are interested in dentistry. So the EMS gives you a wider range of people to deal with. But again, we're not ashamed to say that if you come to the paramedic program and your purpose is to become a nurse, we're gonna make you the best paramedic in that time, so that then you can use that information to become the best nurse that you can be. So, and we're really big. Everybody in our department is really big on the educational piece, and our governing bodies are just starting to recognize that not having curriculums doesn't create a uniform policy. So they've adjusted all that. So in the next couple of years, we will only be able to give certificates to EMTs.
Oh, wow.
Because as a paramedic, you'll have to go through a program. So even the fire departments will have to be affiliated with a college program that could get their fire students a bachelor's, an associate's degree to then transition for.
So that's even more reason to come.
Yes, definitely.
Future-proof yourself. So I'll give you the final word in terms of as it relates, we've talked a lot about your program, the teaching, but any final words on your love for learning, and just anything as it relates to students coming into the program.
So I know this is going to sound cliche, but I love learning because I love to see the light sparkle. Because I didn't start off as an EMT. I had no idea that I went to the military. I told a recruit I want to be like Rambo, and this was back in the 90s. So 2 weeks later, I was on a bus going to Georgia.
Okay.
But I love teaching. I love learning. I love making sure that I'm on top of the game, because I want to make sure that student that's on top of the game, I can make sure that I give them the right answer and lead them down the right path. And there are students that we've had who, again, aren't paramedicine, just wasn't their thing. So what we do is we'll sit them down and what are you looking for? How can we help you? Let me take you over and talk to the director of this program. So see if it's what you're interested in. And so that's one thing that I'm glad that we do. We don't turn anybody away, even if they don't want to be a paramedic. And
that's really great.
My love of learning is that I try to imbue that into the students, and quite frankly, for the most part, as an advanced paramedic, my love of learning came because there were a lot of times in the last 20 years where I was the only one in the room that looked like me.
Right.
Because the advanced training requires, so as a critical care paramedic, I take the same test that a critical care nurse would. And again, what happens, because EMS gets kind of brought under that firefighter umbrella, people don't understand that there's a level of knowledge that you have to have, particularly if we're talking about someone having a heart attack. So I want to make sure I'm learning and make sure our students are learning. And lastly, our students make noise when they go, because our students are ready. And so we've always gotten good reports. The school has gotten good reports about our students. So we also try to make sure that with that learning, they understand that they're a part of a bigger family. So you need to, watch what you say, watch how you act. So,
and it doesn't, and I appreciate that. It doesn't get more critical or essential to like just civilization and doing what you all do. So we really appreciate your service and just, we know during the pandemic, the amount of, that we had to lean on your field and, and the growing amount that we just continue to have good folks who are trained well. So I really appreciate you joining today. Thank you so much for the time. And again, thank you all for tuning in to For the Love of Learning. I'm your host, Dr. Carl S. Moore, Vice President for Teaching and Learning here. You can tune in, view us on YouTube. You can listen on Dragon Digital Radio or Podbeam. So until next time.